Good evening and welcome. I'm Jennifer Rabb and have the great honor of serving as the president of Hunter College, where the American dream has been coming true for more than 150 years. From its earliest days, this school has been devoted to an idea exemplified in our motto, Mihi Cura Futuri, the care of the future is mine. And this evening, we will be reminded again that this obligation is shared by the extraordinary public health community of New York City. After helping us through the worst pandemic in a century, our doctors, nurses, and healthcare heroes continue to provide day-to-day services in a mind-boggling array of specialties. And our neighborhoods are healthier for their care and their caring. Tonight, after a COVID-related hiatus, it's a very great pleasure to welcome all of you back to one of the true highlights of the Hunter College calendar, the Joan H. Tisch Community Health Prize at Roosevelt House. As you can imagine, I think that's worth it. As you can imagine, tonight's event has been very special, very profound meaning for me. When we started this prize, we set out to honor the true heroes of the public health community, and we are now giving out our 10th year of Tisch Health Prizes. I think that deserves a round of applause. And what a more perfect spot to hold this and all of our previous ceremonies than here at this venue. I'm so proud to have worked to saved and repurposed Roosevelt House. 80 years ago, the Roosevelt family officially transferred this, their longtime family home, to Hunter College. Eleanor Roosevelt herself gave us the key because her husband, the president, was otherwise engaged, as they say, on a top-secret ocean voyage to Tehran for a summit meeting with Churchill and Stalin. And I think there's actually the picture. Quoting him on our campus that day, Eleanor reminded us, quote, to look on all human beings with respect and always, quote, to have true understanding of the points of view of others. We have worked to live up to that goal ever since. It has been our passion through all the years since we've restored this building and reopened it as a public policy institute dedicated to the Roosevelt legacy of public service and human rights. Among these rights, as FDR said in one of his last fireside chats, was the right of every American to good and affordable health care. As we know, FDR did not live long enough to make that dream a reality, as he had done so brilliantly with other social innovations hatched right here at Roosevelt House when it served as his transition headquarters for the then President-elect Roosevelt, starting in November 1932. Those of us who work, study, and teach in this living landmark never forget that 10 years before the New Deal, this house helped facilitate one of the most inspiring health stories of the 20th century. This house is where FDR made an amazing recovery from a disease that rendered most of its early victims fully paralyzed. And without hope, it was then called a normal life, much less a life dedicated to helping others and at the highest level of public service. It was under this roof, at Eleanor's urging, that FDR fought back against polio, the polio that had robbed him of his ability to walk. Here, not upstate at Hyde Park, where he might have remained isolated for the rest of his days, living in comfort but without purpose, and unavailable when America needed his leadership most. Partly, it was because this house had an elevator, a rarity in similar-sized townhouses of that era. That was certainly one of its great assets. That and the fact that FDR's mother, Sarah, had given the western half of the double townhouse to the newlyweds as a Christmas gift in 1908. To be sure, FDR would make full use of the elevator, using an armless wheelchair that could fit into the narrow cab, a wheelchair style he would favor for the rest of his life. But this building also gave FDR access to the wider city and the many opportunities and advantages that had always provided its residents, visitors, and indeed its students. In the library upstairs, FDR practiced dragging himself back and forth on crutches, wearing heavy steel braces until he could maneuver his frame the entire length he would need to walk to the podium for his comeback at the 1924 Democratic Convention. There he showed the world he was again capable of leadership. And it was here at this house where he delivered his first fireside chat after winning the 1932 presidential election. and where he and his brain trust devised the foundational building blocks of the social safety net, which would become Social Security. We know that FDR always embraced health as a priority, from New York to Albany to Washington, all the way to Warm Springs, Georgia. He helped establish the March of Dimes Foundation, still one of the most transformational health achievements in American history. In the first Social Security Act, FDR launched not only old age assistance, but aid to dependent children and to the visually impaired. As First Lady, Eleanor had a major impact on public policy as well, fighting for racial equality, equal employment, and women's rights, as well as health care and the protection of children. She began her career here, if only to get away from this house and maybe from her strong-willed mother-in-law, by teaching calisthenics at the East Side Settlement House on the Lower East Side, where she came face to face with the brutal realities of poverty. So what a legacy we have in this house. This history animates the sacred space and those who work and learn here, and makes the Tisch Prize ceremony, which we hold here, so very special, especially when it is intertwined with the family legacy of the late Joan Tisch, for whom the prize is named. It's become urban legend, but Joan volunteered without fanfare at the gay men's health crisis in the early days of the AIDS epidemic, starting with small steps that soon raised awareness of the giant challenges that crisis posed. She not only instilled a sense of civic responsibility in her own family, but extended it to the family of humankind. That spirit remains dear to her daughter, Lori, our wonderful supporter, who makes this tradition so possible. The Tisch Prize recognizes and advances the Roosevelt tradition of health innovation and community care, the kind of care that FDR experienced, supported, and symbolized while he lived here and beyond. The Tisch family has made sure the prize is a generous one, meaning that the awards make a tangible difference to those who have earned them, to their organizations, and to the health and well-being of New Yorkers. Honorees cherish the opportunity to introduce their work to a wider public, just as we embrace the chance to help them tell those stories. Applicants work hard to submit complex nominations and gather impressive letters of support. In turn, the $10,000 organization and individual prizes make an impact on both the bottom line of the organizations that they support, spurring the work of these fine practitioner and groups while helping the communities they serve. We have always prioritized smaller organizations working with tight budgets, those for whom these prizes will hopefully attract additional support in the future. In past years, we have seen organizations blossom after receiving the Tisch recognition, and we hope such will be the case with this year's winners. It is so special to have the 2023 honorees together with their friends and families and past award winners here tonight to share this important moment, along with the members of the jury who have worked so hard to reach a consensus this year. Let me thank the jury members. First, gratitude to Dr. David Himmelstein from our public health program, Susan Steinhardt from our board of trustees, and also a former deputy mayor and leader in healthcare in this city, Dr. Lilian Barrios Paoli. A very special welcome also to Joan Grave, also from our Hunter College Foundation board, who has done so much to make the success of our nursing school possible. And then let me acknowledge and thank the founding director of Roosevelt House, who brings back his expertise to this important endeavor, Dr. Jonathan Fanton, for serving as our overall juror and supporter and moving this program forward. Thank you, Jonathan. And then, of course, to the Jonathan Fanton director of Roosevelt House, Harold Holzer. Thank you both, gentlemen. Tonight, thanks to the hard work of the jury, we are announcing, and also the fact that we missed last year, we are very excited this year to announce not one, but two stellar prize winners in each category, individual and organizational, and you'll hear more from the winners soon. I just want to say a special congratulations as we honor individual award winner, Sudhar Acharya, who is the founding executive director of the amazing South Asian Council for Social Services, who has seen to the good health of immigrant communities in Flushing, Queens for over 35 years. We salute the visionary Dr. Yinan Lan, the Homeless Health Medical Director at New York City Health and Hospitals, for her work as Clinical Director of Street Health Outreach Wellness. And we recognize two stellar organizational honorees. First, the Skill Spring program at the New Jewish Home, which energizes the next generation of New York health workers by training high-quality, culturally competent healthcare professionals. And we honor Vision Services for the Blind and Visually Impaired, which assists its many clients to prepare for and then lead independent, active, and fulfilling lives. So we will hear more from our honorees, but let us thank these two individuals and these four groups for their wonderful work. Before we award their honors, I want to call up the person who's really inspired this award by her commitment to public service and by her commitment to honor the extraordinary memory of both her parents. We host many events in this room to celebrate leadership of her father, Robert Preston Tisch. And this night is very special because we remember that the grassroots work of Joan Tisch and how she served in this very unassuming way to bring philanthropy to those who needed it most. Lori really lives her mother's mission. She continues to honor her mom by supporting the works in public health and really finding these unsung heroes. And Lori, I just know your mother would love what you do because you're walking in her incredibly big footsteps, which only you can fill. So I'm just so grateful for the friendship, the support, and just shining, as she shines the light on those who are often forgotten, our public health heroes. So please welcome to the podium our wonderful Lori Tisch.
Good evening, and thank you so much, Jennifer. My remarks are going to be very short because I think everybody isn't here to hear me, but here to hear and honor these really wonderful and inspirational awardees. And I know that, as Jennifer said, this is our 10th year, and I know that there are awardees here hopefully representing all 10 years. So I hope that you will all take a moment to stand up so we can honor you as well, people who've received this award before. Or we'll just clap. We'll just clap. As I've said, every year you are all such a great representation of your field, of our city, and for what my mother stood for. Just a little bit, Jennifer, let me just say that I do not call her President Raab. I do in formal settings, but I've known Jennifer for President Raab for a very long time, which is not why we're here. We're here because nobody could do as good a job as Hunter and Roosevelt House has done with both this award and the award in honor of my father, the other award that we do in honor of my father, Preston Robert Tisch. But I knew Jennifer, President Raab, as a friend, and now I'm going to get choked up. But over the last 10 or 12 years that we've done these awards, we've also become not just friends but colleagues, and you will be missed. You are an inspiration in everything that you do. You have been such an incredible leader, not just for Hunter, but for this entire city. And I won't say I'm going to miss you because our friendship is deep and long, but I know that you will be missed at this university. And I just want a round of applause for what Jennifer has brought. See what happens when you don't get prepared remarks? Anyway, so just a little bit about my mother. My mother she got married very young, right out of college, and unlike me, who was kind of a child of the 60s, had a social conscience, but wasn't so much of a social reformer. More of like 50s housewife at the beginning, very bright with a wicked sense of humor. But in the early 80s, many of the people that she knew, people in her lives, started becoming ill from a disease that at the time didn't even have a name. And that she knew well, and people were beginning to die, and somebody that she knew well convinced her to go to the gay men's health crisis, undercover, and which was her way, and she started helping. They just had the name AIDS had just come out, but nobody was really quite sure what it was, how you got it, if it was contagious. But there she was, and she early on, it was way before the internet. Early on, their fax machine broke, and they didn't know what to do. They had very little money. And she said that she would buy a new fax machine, but here she was, this volunteer. They didn't really know who she was. She said she'd buy a new fax machine. The first question they asked her is, how do we know the check won't bounce? Fortunately, the check didn't bounce, and both my mother and another woman who's also kind of a society woman whose name I'm not remembering right now, really became the women, the early women of AIDS. And they, at that time, they found out that the check didn't bounce. And they asked my mother to come forward and to really not just work the fax machine and write remarks and things like that, but to really come forward and to be a leader. And she did. She wrote letters to all of her friends. As you can imagine, it wasn't the most popular topic at the time. I remember, some of you here probably remember the early kind of 24-hour or whatever dance-a-thons at the Gay Men's Health Crisis sponsored and raised money for. And my father, who was tremendous human being, a great businessman, was not much of a dancer. And I still have memories of him, for 24, dancing at the dance-a-thons. But she got behind it 100%. And that's one of the reasons why we decided to do this prize and name the prize after her. She was not a person who always came forward and sought attention, but she cared very much about the underserved, and she understood the power, not just the power of money and the power of philanthropy, but also the power of stepping forward and getting other people involved. And as I said, that was not that easy in the early days, the AIDS days. So she only passed away at 5 years ago at the age of 90. So she did come to the early days of this prize and was so proud of it. As I said, she didn't seek the attention. Once she got it, though, she was perfectly comfortable with it and loved it. Really comfortable. And just as I always say about my children, my grandchildren, and all of the many grantees that we have at the Laurie M. Tisch Illumination Fund, that we love everybody equally. And we do, but I have a special shout out tonight for Health and Hospitals. And I don't know if many of you know, but one of the programs that we did at the Laurie M. Tisch Illumination Fund, and this book actually was premiered here at Roosevelt House, we had murals commissioned. It was a big commission, very tough, just like this program, in all 26 of New York health and hospitals, in every hospital and long-term nursing facility. It was a collaboration of the doctors, the patients, the communities, the people who worked in the hospitals. And it was such an extraordinary project and collaboration. We're now doing 20 more. And so we have done this beautiful book. And if anybody would like, have you seen the mural in your hospital? Yeah. So there are about 4 or 5 pages about every mural, the story of every hospital, how every mural came about. We are happy to give you the book. So Rick, raise your hand. If you would like to get a book, please let Rick know, and we will make sure that you get a book. So again, congratulations to Health and Hospitals, to everybody, but especially to Health and Hospitals for this inspiring project and all that you did during COVID. We're very aware of the stress that you were under. So that was my short remarks. Can you imagine when I'm long-winded? You don't want to be there. So again, congratulations to everybody, and to Harold and to Jonathan and to Jennifer, President Rabb, and everybody who has worked on this program. We're all so proud to be a part of it, and we'll keep it going.
Thank you, Lori, for telling us your mother's inspiring story, which gives us hope for a more just and humane world. And thank you, Jennifer, for your leadership of Hunter for 22 remarkable years. Restoring Roosevelt House and creating a public policy institute here is certainly one of your many great accomplishments and contributions to making Hunter the best. And I have to say personally, it's been a great honor and privilege to make common cause with one of the leading college presidents of any institution anywhere in the country. So now we'll come to the core of our gathering. Harold Holzer and I will give out the certificates and the awards to our 4 honorees. We ask each of you, as we call your name, to step forward up here on the stage to receive your prize, to pause for a photograph of this wonderful moment, and then to take the podium and share your thoughts. We'll start with the $10,000 prize to 2 extraordinary health institutions. First, we honor the SkillSpring program at the New Jewish Home in Manhattan and the Bronx for its tireless support of New York City youth from under-resourced schools who pursue careers in senior health care, training the next generation of healthcare professionals. Hunter is proud to recognize SkillSpring program at the New Jewish Home for distinguished accomplishment in urban public health. And accepting the award is board member Gingy Pica. Please come forward.
Thank you, Harold and Jonathan, and everyone here. Good evening. My name is Gingy Pica, and I'm a board member of the New Jewish Home, and it's my honor to accept the Joan H. Tisch Community Health Prize on behalf of SkillSpring, our workforce development solution that's transformed the lives of young people from under-resourced communities and schools for the past 16 years. It was this very program that drew me to join the New Jewish Home's board. My first introduction to the program was as a funder. As a senior director of community investment for an affordable housing developer, I manage a grant portfolio that focuses on education, youth development, workforce development, health, and social justice. And I recognized what a unique workforce program SkillSpring was, and we awarded the program 2 grants to support its efforts. We are incredibly grateful to the award committee for recognizing SkillSpring and the impact that the program is having. Just a brief background on the program. SkillSpring offers 2 pathways. One is an intensive 3-month program for disconnected young adults who are 18 to 24 years old. The other is a 3-year after-school program for high school students in the 10th through 12th grades. Both pathways address the significant challenges and barriers faced by young participants and provide a path forward. They also enrich the lives of older adults and create a culturally competent healthcare workforce that values and appreciates older adults. In addition to getting hands-on training in clinical care, our young adult participants receive case management, guidance in professional development, job readiness, and financial literacy. In just a few months, they graduate as certified nursing assistants, or CNAs, and are guaranteed a job offer at the New Jewish Home or at a partner skilled nursing facility. Our high school participants receive tutoring, college readiness, CNA certification, internships on the units of the New Jewish Home, and have elder mentors. These are residents of our Manhattan nursing home. By the time they graduate, our high school participants have spent an incredible 8,000 hours with our older adult residents, creating trusting bonds and learning to provide skilled and compassionate care. They're often the first in their families to attend college, pursuing health-related majors and supporting themselves working as CNAs. Receiving this prestigious prize is a culmination of SkillSpring's efforts. This is also quite a memorable week for the program. Just yesterday, we graduated 12 young adults, and tomorrow we'll celebrate the achievements of our 42 high school seniors, all of whom are college-bound. Among our graduating class, one participant will attend the prestigious Sophie Davis Biomedical Education Program at the CUNY School of Medicine, and another will go to Cornell University. 24 of our participants will enroll in SUNYs and CUNYs. Since 2006, 1,100 young people have graduated, and an incredible 91% are currently either working in healthcare or enrolled in post-secondary education. We're proud of the impacts of the program to date and are currently working on expanding and replicating SkillSpring across New York State to help continue to transform more lives and communities. Again, I'm truly honored to accept this prize on behalf of SkillSpring. However, I'd like to invite our SkillSpring staff and students, Khadija, Melissa, Catherine, Yusra, and Gabriella, to please stand so we can recognize them and give them a round of applause. This prize belongs to you and every team member who's contributed to its success. Thank you.
Thank you. I'm Harold Holzer, and I serve as director of the House. And I do want to echo what my illustrious predecessor and namesake said in noting the achievements of my boss, Jennifer Rabb. We are meeting in a place that would not exist if it weren't for Jennifer Rabb. And I hope those of you who come to our reception later will have a look at the exhibit on view that just opened. It talks about the original building of the house and the preservation and repurposing of the house. We like to say, and we'll have bookmarks for you to take home the sentiment, this is the house that Sarah Delano Roosevelt built, Eleanor Roosevelt ennobled, and Jennifer Rabb saved. And we're meeting in the old kitchens of the Roosevelt House. Had not Jennifer said, we need a public gathering spot, we wouldn't have this community place. So just as the kitchens nourished the Roosevelts, this auditorium nourishes the students and the faculty and the community. And here's our master chef. Thank you, Jennifer. Next, we honor Vision Services for the Blind and Visually Impaired for developing and implementing programs to assist clients to lead independent and active lives in their homes and communities. The work of Visions aims to educate the public on the capabilities and needs of the visually impaired so that they may be integrated fully into all aspects of community life. Visions provides rehabilitation at home and in the community, social services, employment training, and group and community education and activities. And so Hunter College is proud to honor Visions for distinguished accomplishment in urban public health. Accepting the award is CEO Nancy Miller.
Thank you so much for this honor, for the work that all of the staff, volunteers, board members, and supporters of Visions have been working on for 97 years. I've been the CEO for 35 years. And I see some of my colleagues, Lillian, who I know quite well from her time at the Department for the Aging, and we have aged well together. But I want you to imagine what it was like at the time of the pandemic for somebody who can't see. It was hard on all of us to be on lockdown and to be isolated in our homes. But what about somebody who didn't have a thermometer that they could read to know whether or not they had a fever? What about a person who didn't know how to access any kind of online services, who didn't know how to get food because they didn't know or couldn't access a website that was not accessible for their local supermarket? What it was like for somebody who was blind to not know if somebody was 6 feet away? What it was like for somebody who was older, not able to see, and isolated alone in their home with no one to call or talk with? Vision staff rose to the occasion. We gave out free of charge thousands of talking thermometers that enable people to take their temperature and know whether or not they might have gotten COVID or the flu or any other health issue. We had our rehabilitation staff who were amazing in their innovative ways of providing service, including some staff members who were teaching independent living skills through a window so that they could manage to stay 6 feet away, or be in a hallway, have a doorway open, and be able to teach with that 6 foot distance. We gave out free PPE for months for people who needed it. And the population that we serve is primarily low income, primarily represents communities of color, primarily represent people where English is not their first language, and they're dealing with blindness or severe vision loss. This award is really a thank you and a recognition of how we can rise to an occasion during a time when all of us were under tremendous stress, where we didn't have solutions in front of us. We had to come up with them ourselves. And in fact, the Vision staff did just that. A special thank you to our funders and to our board of directors who gave us special grants that enabled us to weather the storm of the pandemic and to continue to provide services without a single break. Our staff, as soon as the governor and the mayor allowed us to leave our homes, they were back out in the community in July at a time when many people were still staying at home because they knew that our participants needed them. So thank you so much for recognizing their hard work, and we continue to do what we do best, which is help people see all the possibilities of what life can be like with or without vision. And as one of my board members say, the only thing that blind people can't do is see. Thank you.
Well, the evening goes on, and it's just wonderful to see so much talent, so inspiring. I thank you. We now move to the category of individual prizes, and we begin by recognizing Sudha Acharya. And let me read an excerpt from the citation. Since founding SACS, the South Asian Council for Social Services in Queens, she has been a major advocate for South Asian and other immigrant communities. And under her leadership, SACS has provided access to affordable health care to diverse, predominantly low-income residents for a quarter of a century. So with deep admiration for her leadership, Hunter College is proud to honor Sudha Acharya for distinguished accomplishment in urban public health.
Thank you so much. President Jennifer Raab, Ms. Laureate Tisch, and the selection committee of friends and supporters. It's an absolute honor to receive this prize. When I think about the historic building in which I'm standing here, and the prize that is named after such a great philanthropist, the prize becomes even more precious to us. South Asian Council for Social Services, or SACS as we call it, is 23 years old, a young adult in human terms. Over these years, we were striven to address the needs of underserved South Asian and other immigrants. Our involvement in the healthcare or health area started almost as soon as we were founded. 9/11 struck New York, and we had to jump into action right away to help to serve the families of direct victims of 9/11 with case management and mental health counseling. But we continued to be involved with healthcare, right? And over these years, we've been connecting them to healthcare and addressing their physical as well as emotional well-being. We recognize that the social determinants of health, which make up our health, it's very, very important. Health, food security. When I talk about food security, we're talking about culturally palatable food. You need to give a person what they eat. Not, it doesn't matter if you give other food to them. Food security, connection to other benefits, and job training. These are very important, and they make up for. So, one other very important factor is we need to have cultural sensitivity, and we also have to serve them in their own languages. Our staff speaks 19 languages. 12 of them South Asian, and other languages such as Mandarin, Cantonese, and Spanish. That serves the diversity. We're in Flushing, so you know how diverse it is. So naturally, we are able to serve them. Right? Yeah. We are lucky to have a great staff which does amazing work as well as brings such compassion to their work. Stand-up staff, SAC staff. Yeah, right? So, and the two directors, Director of Health Services and Director of Family Support Services, Rehan Mahmood and Mary Archana Fernandez, lead them expertly. Okay, come on. Yeah. We are very fortunate to have a very supportive board, and we have great volunteers and other supporters as well. Yeah. The pandemic has hit our communities very hard. Right? They have lost their loved ones, they've lost homes, jobs, and confidence, which has really demoralized them. I think we need to make sure, as you know, many of the government emergency services have come to an end. So it's extremely important for community-based organizations such as all of us to gear up and help these very vulnerable people. In the healthcare field, we are very fortunate to have partners like Community Service Society, Immigrant Health and Cancer Disparities Center of Memorial Sloan Kettering, and NYU Langone. We work closely with all of them. I have the same admiration for health and hospitals that you have. We work very closely with them because we serve a lot of people, uninsured people. And where do we send them? We have to send them to the public hospitals. And we have to advocate now for healthcare for all And we talked about President Roosevelt wanted healthcare for all, and this is what we are advocating for, and just making sure that their health is taken care of. So this prize will energize and really inspire us further. Thank you so much.
And finally, we recognize the extraordinary Dr. Yinan Lan. We honor her for her work as Clinical Director of the Street Health Outreach and Wellness Primary Care Safety Net Clinic at Bellevue Hospital and as the Homeless Health Medical Director at New York City Health and Hospitals. A tireless advocate for the city's unhoused, she created the Primary Care Safety Net Clinic to provide primary care to medically complex individuals living with homelessness and housing insecurity. And so for her visionary leadership and dedication to improving the care of the most vulnerable New Yorkers, Hunter College is proud to recognize Dr. Yinan Lan for distinguished accomplishment in urban public health.
I have to confess that I was terrified coming here and preparing for the speech. There are many speeches, many speaking engagements that I've done before, but for some reason this one kind of, and it just dawned on me, the ship that I'm kind of representing. Until one of our number one work cheerleader, Deborah, reminded me that it's not about you. This is actually about all the people that actually brought this work together. So we're good now. I think I can move on. Close to a decade ago, there was a young resident that was coming out and looking for a job, and Dr. Andrew Wallach decided to give her a chance to enter the world of the public hospital world, and that's the Bellevue Hospital. And that allowed me to join a group of very like-minded people with access to close to 1 million New Yorkers and close to 50,000 of them that are living on the street, living in temporary housing or shelters or various couch surfing. Since then, a lot has happened. The public hospital system sits in a very privileged position in having that access of the number of people that comes through. And maybe about 5 to 6 years ago, we started to kind of listen in on the people around us really carefully. And I started to become very curious in terms of just all sorts of, lifestyles and details. And there are a number of rough sleepers in New York City who have taught me a number of things in terms of what is it like to go out when it's close to dawn, to look for a spot, to pick a box or pick an item so you're not directly on the floor, pick a corner that you're not exactly exposed. What is it like to enter the shelter system for the first time, for that day that you decide to enter because of a relationship break, because of a comfort system or a safety net system that has given in? What is it like to be sitting outside of, actually in front of our hospital, because part of you believes that your children is in there and you're waiting for them to come out. All these points kind of brought lessons and information that were highly valuable, and it connected to the human part of us that we can all relate to. The community-based organizations at that time took the time and effort to teach us what was there already, the landscape of homelessness, and what's still missing. And what's there already are these community and shelter-based clinics that, a huge diversity of them. What's missing is comprehensive care for people with the highest need. And so at that time, the thought was that if we're able to bring care to one location, if we bring all the elements to one spot, perhaps we could really change a course for some lives. And that's sort of when our various people from Health and Hospital came together. I call that the stars aligning at that moment, from central office leadership to the clinics within Bellevue. I'll name drop two people here, Annie Garment, Isaac Holmes. They're sort of the supervisor and also peers that kind of really protected and sheltered this dream of saying that we're seeing what's happening. We're seeing what's happening to the patients that are living outside, living in shelters. And when they do come through the hospital, they are usually coming through the emergency room and coming through the inpatient side. And when we're looking at the patients through their first admission, second admission, third and fourth, and then becomes more frequent, we start to see unraveling of their physical characters. The skin start to change. You start to see the thickening of the skin. You start to see the organ system start to fail. The mind and the body are unraveling. Usually, by that time, people will die 1 to 2 decades earlier than the rest of us who do have a bed to go back to. So we kind of looked at what role we could play in terms of acute care, or in terms of the gaps, the privilege that we have access to. And at that time, it was sort of the outpatient acute care level. Think about an ICU but from an outpatient level. When we do get critically sick, oftentimes we don't have to. If we have to go through the ICU, we don't have to go through each individual specialties or get resources individually. They are often there in one spot. Similar to people who are going through crisis, that resource should also be in one spot as well. So with that sort of thought in mind, with the stars aligned, that's when things started rolling off. The primary care safety net clinic that did start at Bellevue is getting expanded at multiple other clinics as well, including Elmhurst, Woodhull, and Lincoln Hospital. In addition to that, the many other people who are behind this ship, some of them who are here today, Andy Cook, Anne-Marie, and Amanda Johnson, and the whole team that's kind of behind the effort of expanding this clinic to involve multiple public hospitals, so that can be connected to further to our street medicine program as well. And the idea is that when someone is living outside and is experiencing some of the worst form of poverty, that they don't have to navigate through all the different fragmented resources. And we live in a city, a great city, with resources. It's just that it's fragmented. So how do we get that together? When we start to see the people who are getting housed, that their trajectory really changes. What happens with unraveling of the body, of the mind, when they're exposed relentlessly to the element, kind of unravels, ravels itself, spiral back up as well. When they're provided with appropriate housing, their chronic medical diseases, their mental health, everything kind of gets better. When there's stability, when there's support, when there's connection to family, everything starts to come together from there. I think other things that I'll really give thanks to is that this environment of that I get to work in, of people, and our clinic nurse is actually here today, Sally Kadar, and our addiction counselor and other people who are just really giving me pep talks today, coming here. They kind of show me that it's okay. This is just, you keep on showing up every day, day after day, because we don't get to give up. We don't get to kind of decide that this is too much, or this is way too much for us, or way beyond us. We have a bed to go back to. So we navigate the system on behalf of people who cannot. And and I think really, thank you, really grateful for this award.
What an inspiring evening for all of us. Thank you so much for joining us at the 10th and maybe the most memorable of the Tisch Prize ceremonies. Congratulations on behalf of President Raab and Lori Tisch. Congratulations again to the winners, their boards, their families, their staffs, their friends. previous winners who may be tuning in on Zoom, members of the jury, and we're joined by the final member of the jury, Dr. Basil Smikle, who's here at the back of the room. Thanks to Rick Lofglass for his guidance always, and thank you to Lori for all you do. Please join us upstairs at a reception in appropriately the Roosevelt family's original dining rooms, where we will celebrate the winners of the 10th Joan Tisch Prize. Thank you.